at the end of the day, the only reason that we're in it is we think we can do it better. And I think in 4 years, we've already shown that we can do mail order pharmacy better than anyone else. And I am a firm believer that as more and more people actually experience and see it, it'll become immediately obvious, like, gosh, yeah, they can do something that no one else can.
And now, from San Francisco and the UCSF Rosenman Institute, the Health Technology Podcast with your host, Christine Winoto.
Our guest today is Dr. Vin Gupta, a distinguished figure in public health and health tech. Dr. Gupta serves as the Chief Medical Officer of Amazon Pharmacy, where he leads clinical strategy and innovation in pharmacy services. He also holds faculty positions at the University of Washington's Institute for Health Metrics and Evaluation and the Evans School of Public Policy and Governance. Dr. Gupta's career has been shaped by a unique blend of experiences, from his medical training at Columbia University and Harvard to his service in the United States Air Force Medical Reserve Corps. With a focus on impact at scale, his work has greatly advanced healthcare policy, clinical research, and the integration of technology in healthcare. In this episode, we explore Dr. Gupta's engaging and unique professional journey, his insight into the consumerization of healthcare, the role of technology in improving patient outcomes, and his vision for the future of pharmacy services. Enjoy our conversation. Welcome, Vin. Thanks for joining me today.
Thanks, Christine, for having me. Great to see you.
It's been a while since I want to have you on my podcast to share your story with all our listeners here today.
Oh, I'm delighted to be here.
And one of the things that I like to start is always about your personal journey. And oftentimes, our path not always a straight line. And some are more straight line than others, but still, nevertheless, it's never a straight line. My question to you is what are the things that helped you to get where you are today, and what shaped that path and direction to lead you to where you are today?
Well, thanks, Steve, for having me again. And I think this is such an essential question for where we are in healthcare more broadly. Because I talk to medical students, trainees of all stripes across all the various healthcare cadres, and I get this question often, which is, how are you able to branch off and do something a little different, but with a focus on impact beyond the bedside? And that was always what motivated me, just coming up in what I think was the generation that really was impacted by 9/11. I was actually just recounting this story over the weekend to a friend, how my very first day moving into a dorm when my parents dropped me off was September the 11th, and we're 45 minutes south of New York City. And I think it was at that moment, and I know I say this for many of my peers who were freshmen in college on that day, that there was something about that moment and growing up in the post 9/11 world where the desire to have impact, public sector impact, just like that desire in the baby boomer generation really was what was tangible after Pearl Harbor. It was hard not to get seduced by that mission, by a sense of patriotism, by a sense of wanting to give back. And because we're all witnesses to something that I think, has had no peer in our lifetime. We've had a lot of disruptive events, of course. We continue to see them in our news to this day, but nothing quite like that. And I want to say that, coupled with an upbringing, being the son of two immigrants, that really made it. My dad's an engineer, my mom's was a neonatologist, and seeing their struggle, it felt like, well, gosh, to do right by them, I needed I needed to do something different, and not just recreate a good paycheck, but to really try to take all the ingredients and privileges that I had growing up, being the son of two immigrants who really had to struggle. And then two, growing up in this post 9/11 world where I think all of us in that generation felt a deep desire to reach people that had less than we had or that were suffering, or to try to have impact beyond our blast radius, whatever we were studying at that moment, to really think big and to think outside the box. And so it was that 1-2 combination that motivated me in what was a very uncertain next 15 years of my life, which was following passions, having mentors who saw my journey and what I did and say, what are you doing? In some cases, just sort of scratching their heads. But in allowing me to carve out at every step of the way a more interesting personal journey, I think a niche that was not filled by others. And it was ultimately somebody that was interested in clinical care at the bedside, but was very curious about the world around them. And I joined the military, who helped subsidize my medical training. And it was the Air Force Reserves. And it ended up becoming extremely impactful on how I viewed the world. Very interested in international relations and diplomacy, soft power, and how I think, so the best of American diplomacy is when we leverage whatever foreign aid that we have to advance shared goals. And in many cases, that's buttressing healthcare systems. And this is well before COVID-19 and Ebola. Often the feeling, and this was actually in the height of the George W. Bush administration with PEPFAR, that America at its best often, especially when viewed through a global lens, is us supporting shared goals. And often across the global South, it's in healthcare. And so I got very interested in that nexus of healthcare, foreign policy, soft power. I had overlaid in that this interest in, or these experiences in the military. I spent over a decade now in the military, something I didn't expect going in, but was very motivated to understand, be a part of, again, as a result of that post 9/11 experience. And it really, interestingly enough, lots of things in between, but got a degree in international relations, studied it towards that degree in the midst of a residency, sort of back and forth to Cambridge, through a program that was funded by Rotary International. Just sort of a series of dots I never would have connected beforehand, but so privileged and lucky to have done that. And it was through my military experiences, having these academic experiences in international relations, ultimately studying public policy during my fellowship when I was at the Brigham, training to be an ICU doctor, had these sort of side academic experiences that allowed me to build a diverse skill set. There's not many people don't think of pulmonologists as individuals that might have a military background or might be interested in international relations, diplomacy, or public policy, but I just followed what made sense to me. And it was through the military that I had my first exposure to health technology at its finest. What we're using to care for injured soldiers at 30,000 feet in the back of C-17 often is the latest, greatest technology that you wouldn't see within the four walls of a ICU at sea level. And so that birthed some opportunities in health technology. I was at the Brigham, having an opportunity to advance my interests in public policy. At the same time, I was training to be a pulmonologist. And my mentor at the time was helping the Apple clinical team on vetting the Apple Watch and its EKG functionality. And I got involved with that because I was really interested in health tech and devices as a result of my military background. And then that ultimately parlayed me into the world of health technology, consumer health tech, worked for Apple part-time, and then got connected to folks at Amazon pre-pandemic. And lo and behold, here I am 5 years at Amazon, still a clinician at the bedside and still very much involved in messaging and public policy. And so for me, it was, and this almost sounds like a cliche, but really without the benefit of mentorship that I think believed in my path up front or in what I was doing, just following curiosity and following the things that I thought would matter and would allow me to then build a skill set that would allow me ultimately to have impact at scale beyond the bedside, which was always the goal, was impact at scale.
Well, I like how you frame it, how has the mentorship and following your curiosity, and then with the North Star is really making an impact by the bedside. You got to do a lot of that too still, which is really nice. And I want to, before we go dive into a lot of the activity that you're doing, you mentioned a lot about earlier about this, the power of soft power and through healthcare. And oftentimes it's hard to quantify right away. I feel like now you hear a lot more people complaining about the US spending money, which is really for the soft power. To those who are feeling skeptical about spending money in order to get a soft power, what are the things that those are missing?
As somebody that has seen and very much involved in both traditional hard military power, the projection of that, I'm on the medical reserve side, so it's different, but I see it, and I see how our highest military leaders talk about our national security priorities. What I think gets missed is there's a short-termism to our politics, and unfortunately, and this is not just us, it's every country, it, as a result of the short-termism and winning the next election cycle, you have to talk about things that people can seize and understand and hold on to, and in some cases feel like they can see immediate results and impact. And soft power is not necessarily that. There's soft power, as when projected well, takes a long time horizon of investment and commitment on the part of the benefactor, in this case, the U.S. government, to realize true impact and to really feel like we have um, delivered on that investment. It's not going to be, hey, let's build X number of battleships, or let's pivot our forces to the Asia Pacific, or have X number of airstrikes. The way in which we think about projection of power is quantified in hard military terms and in ways that can be then relayed to the American public almost in real time. We've done X, Y, Z. We need more money. Which candidate's going to invest in X, Y, Z? It's a lot easier, and it lends itself to short-termism. Self-powered, though, in this era where I think the greatest threats to our civilization are not necessarily hard power, nuclear. They're much more biological. And when it comes to, say, the threat of climate on health, on all of our health, or the ways in which, it feels like the next pandemic is quite literally around the corner, given everything we're seeing. And there is absolutely insufficient resources, certainly no consensus on how we as a global community of nations should be addressing this. And a lot of a strategy that was well considered and thoughtful would really lean into soft power. How do we get people? How do we get diplomats? How do we get statesmen across the world, especially the global South, to say, you know what? Yes, we believe in the vision that, say, the United States and maybe the G7 are really putting forth. To have the buy-in that we need, Christine, to really have the impact and the results that we need for, say, climate and COP29 next year, all those things, better pandemic preparedness, we need people to really buy into it. And right now you don't see that. You see all of us working at cross purposes. And I think that's because we've underinvested in soft power, in true meaningful foreign development assistance for health, for climate. We're just not even close to where we should be. But we're over-investing, again, on traditional military threats in my mind. Conventional warfare with all our usual rivals. Lots of talk there because, again, we can talk about it, and the results from that are much more available in the short term. Versus, hey, how do you measure some pandemic preparedness? It's much more abstract, and it's harder to show to voters and to the public. Hey, we've done X. Here's why. Much harder.
Yeah. I think once you're saying that, it kind of make me think about, we are in the world of, we work with a lot of innovators. It's all soft power in a way, is building that relationship. And it takes time to see the result. It's not that you meet that person one time and they invest right away in you. It's in a way, there's that similarities, and it takes time, and sometimes it takes a while to see the result. So when you lay it out, you get to work with Apple and now at Amazon. Those are the two tech company. Like if you think about it, 15, 20 years, maybe 20 years ago. We never thought about them being in healthcare. What are the things, if you can share with us, what Amazon thinking about the consumerization of healthcare?
Well, we're led by our CEO of Amazon Health is a gentleman by the name of Neil Lindsay. And what I love about Neil more than anything else is he really built Prime. And Prime now is, you could argue, is probably the most successful part of the retail business at Amazon, and probably the second most successful part of the business across the board relative to AWS. It's an iconic part of the brand, and it just goes to his brilliance as a marketer and understanding what people need and want from a consumer lens. And he's really trying to bring that savvy and that perspective and that success to the healthcare consumer experience, because we're all consumers of healthcare, whether we talk about ourselves as patients or consumers. And he pushes us on the clinical side to let go of some of the hardened thinking that we have on what the patient experience should be, and to think of patients to some degree as autonomous consumers that deserve a seamless customer experience. That was really hard, and it continues to be hard for me to sometimes talk about patients as customers, because I think it it it, it runs the risk sometimes of making the experience feel less sacred and as serious as it should be. But he's not compromising on that. He wants to bring the best of what Amazon does for the customer and overlay clinical excellence to really create magic. And that's what we're focused on. I help, I'm one of our senior leaders at Amazon Pharmacy. That's where I spend the bulk of my effort in my Amazon role, is on pharmacy and scaling what we're doing. And what I can say about Amazon Pharmacy is I think it genuinely is the pharmacy that we desperately need in this country. It's not working in the retail space. The retail space is just not working. It hasn't worked for decades. Throughout my entire medical professional life, I can't think of patients, certainly the majority of patients, saying, God, they love their pharmacy experience today. And they can't wait to go back into the pharmacy the next time they need to get their meds. It's a grudge purchase that no one at scale, I'm sure there's exceptions, but you can't credibly argue that such a critical part of the patient journey in our healthcare system is working. We talk so much about the healthcare system not working in the United States. I think a big part of that is people's, almost disgust with how we make them navigate something that is so fundamentally unappealing. And so it is really right for Amazon specifically to be able to do better. And I think that's what you're seeing. People love Amazon Pharmacy. JD Power just rated us as by far and away the best mail order delivery pharmacy experience that exists. Forbes gave us 5 stars on their recent evaluation of us. We're proving ourselves to be exactly what people expected of us when it came to at least the pharmacy space. And it goes to show, Christine, that some of the habits and reflexes we've developed as providers, and then as a result, as patients, make no sense and need to be revisited. Why are 90% of prescriptions picked up physically at the retail counter? I get maybe 10 years ago why that was a necessity, because there wasn't a great alternative. Providers struggle to figure out how they can onboard their patients to a mail order pharmacy experience. Mail order used to take a week at minimum to get your meds. Nobody wants to wait that long. But now we're seeing something very different. Me as a provider can go directly into the EMR, the electronic medical record, type in this case, Amazon Pharmacy or Cost Plus, or name your preferred retail farm or mail order pharmacy. And it automatically gets sent to the mail order pharmacy. We automatically then ship it that same day. And the experience is seamless now for both the provider. Patients now are getting their meds delivered direct to doorstep, in certain cases in just a matter of hours, if you have an antibiotic or antiviral need, or across the country in under 2 days. In some cases, we're much faster. That, to me, to your original question about consumerization in healthcare, I know sometimes people think it's a bad phrase, consumerization of healthcare, but I say this as somebody that is at the bedside in a traditional healthcare system in an ICU when you could argue there's been a lot of upstream failures in somebody's healthcare. Boom, they've landed in an ICU. I think we're tackling a critical problem, which is that doesn't get talked enough about, which is people do not like engaging with healthcare, certainly pharmacy. As a result, 30 to 50%, based on the estimate that you want to look at, of American adults do not regularly take the medications they're prescribed. And we know medication non-adherence and poor patient engagement are one of the biggest risk factors for ending up in the emergency room. They're already plugged into care. They're just not utilizing it the way they should because either they're annoyed by the experience, they don't like it, they choose not. 30% of people don't refill their meds at all because it's too difficult. So imagine then Amazon doing what it does really well on the retail side, but applying those learnings and those strengths to pharmacy. I think there's synergy, and I do think we're breaking through.
I really definitely think that convenience is, once you have that convenience, you don't want to let go. I mean, I'm a Prime Amazon members, and boy, everything we do first thing is like, what is in Amazon? One of the things that, Amazon can do all this work at the same time because they have all the right platform to begin with that they tried with a lot of other things. And I was just wondering, like a lot of other pharmaceutical, not the pharmacies, is like the CVS, the Walgreens, maybe in the beginning, they're looking at the incentive, like you come to my pharmacies, then you go to the store. So there's that alignment there. Do you think with the Amazon being a big player now, they're changing that strategy? Do you think we will see a lot more of that? But
Yeah.
how about all the mom and pops, the small pharmacies?
Yeah.
How do they adapt?
Yeah, I would say that we're so very much on the early phase of our maturity, and the big three that are vertically integrated models, where the pharmacy owns the PBM, owns the insurer. That's not us, and as a result, they control most scripts. They receive most scripts in the country. Our script volume is comparatively smaller, and yet which is to say, I just think there's enormous opportunity. There's so much opportunity to improve on what the big three, I think, are just not getting right, which is everything we just talked about. Enticing people to come get your med and then buy some other stuff in the back of the store may have worked in the past, but I do think people, as a result of the pandemic, are becoming much more discerning about their healthcare choices. They're much more willing to receive healthcare at home. The biggest part of the revenue model for healthcare systems across the country is home healthcare, which is why you're seeing a lot of investments in at-home healthcare. I think part of that is people are recognizing that they have to do that because staffing within the four walls of any healthcare system's ward in the inpatient side is challenging, and it's tough to staff up to get a full census. I mean, I will say that we're rate limited not by beds or ventilators in the ICU I practice in Seattle. We're rate limited by, do we have adequate staffing? Literally, that is the issue. So how do you care for more people with less physical human resources? You hope that you can keep them within your catchment, but try to keep them within an at-home healthcare ecosystem, an environment that you're powering. And so because of all these trends, because health systems have an incentive to do so, because people are more willing and leaning into convenience, I think accelerated by the pandemic, that's where I do think the model that the big three have established by just organically is going to get challenged because people's preferences are different. No longer is picking up, a roll of napkins and some chips plus your chronic medications, is that convenient or in any way improving one's life. We had an internal survey show that people spend on average 13 hours of their life every single year waiting in the pharmacy line physically every single year picking up their meds. That astonished me when I heard it. I knew it was a lot. I just didn't realize it was more than half a day. So I do think the incentives that used to maybe drive people to say, okay, I'll bite my lip and go in, are attenuating, and which positions with companies like ours, whose core strength is logistics, to be a place that I do think more and more people will look at as an alternative that at the end of the day will allow them to more easily afford and stay on their medications, which ultimately is a really good thing for public health and individual health. That's where I really think our secret sauce is. I think Amazon Pharmacy is best positioned to drive better clinical outcomes. It's the most clinically centric pharmacy. We have 24/7 clinical pharmacists on hand to answer questions. I've seen the questions that this team has to field. It Without them, where did the patients go? They call into a retail environment that has closed hours. We all know it. We've all experienced it. They would have to wait for their primary care provider to maybe answer a question. Here we are being able to close that gap. So it's not just logistics and just an industry-leading mail order experience that I think has a lot of ramp for growth. It's also what we overlay on top of that, which is a commitment to deep clinical excellence. And I think that's where maybe sometimes gets lost is we are a clinically centric pharmacy that's supported and run by the very best clinicians. And I think you ask anybody that is saying, why are you here? In my case, why do I have a role at Amazon Pharmacy? I truly think that this is one of the organizations that has a chance of upending an industry that needs serious upending because of its pre-existing strengths. If you go to an upstart in the space, and there's many upstarts, they have challenges to scale, and we don't have those.
I think it will be interesting to see. Definitely, I felt that once you experience convenience, it's hard to go back. And
Exactly.
I think people who used to go to the store, I used to go to the store, now I hardly go to the store. So it'll be really interesting how that is changing how we consume healthcare. And my last question, when it comes to innovation, how does Amazon work with innovators? Or is it mostly done through insight innovation, or is it pretty active?
From my observations, because a lot of this is obviously public, so what I can share is I've seen everything from very deep partnership where there's MOUs and statements of work where we try to move quickly to get something done. So if it's somebody's developing an amazing diagnostic and we can help with patient recruitment and helping hasten the completion of a clinical trial that might ultimately help with the FDA 510K, we've done that. We will do that. And because I do think there's a commitment to just want to see if at the end of the day, what we want is a holistic end-to-end patient experience that has the best in diagnosis paired with the best in treatment. Because you can't just have one part of that be amazing and the rest of it still be anachronistic and old school. You need the whole patient experience to innovate. Otherwise, you're still going to have a critical dependency that's going to be unpleasant. So we really believe that everything from triaging and diagnosing a medical problem to then receiving treatment for it, if it's appropriate clinically, needs to change. As a result, we also understand that we're better at some of those functions than others. And so if it's on R&D for the greatest diagnostic for, say, chronic disease, not sure if we're the best for that. But I know a lot of third-party vendors and startups that are doing some incredible work, and they're well aware that we have distribution channels and a patient catchment that's unrivaled if you think about where we could be, given where we already are when it comes to people's home, the Alexa install base, how many people have Prime. And so there's power there in partnering. And so we do that all the time, did a lot during COVID. I think that's where we sort of, built our sort of trained on training wheels, and then we're able to remove them a few years in, all the way to, as it's no secret, acquisition. Amazon Health now is now the product of two major acquisitions: PillPack back in the late 2010s, and now One Medical, of course, in 2023 when it closed. And I do think that those are the two essential ingredients of what will be a successful, what will be a set of successful businesses as part of a sort of a broader three-legged stool. When you think about triaging and providing somebody medical services that are world-class, that's what One Medical leans into, I think, extremely well. If you ask both patients and providers that have experienced it, that have actually experienced it, it is an industry-leading experience for primary care. It allows patients to have 30 minutes of unencumbered conversation with a provider without them having to, do note-taking or be on the phone the entire time. Engagement rates, again, going back to engagement, are very high. People want to engage because they know that it's going to be seamless. They won't have to deal with headaches. It's not going to be unpleasant. And then we've talked about pharmacy, of course. I think the one part of that tool that's missing, that every healthcare organization is thinking about, is how do we get diagnosis right? How do we impart people with insights on their health that will then cajole them to want to take advantage of any of the healthcare offerings around them, whether it's ours or one of our peers? That, Christine, remains a problem for everybody. 40% of American adults have access to great healthcare and have never seen a primary care provider. And I guarantee you some of that 40% needs desperately to see a healthcare provider. They just choose not to because they don't think they need to, or they feel great, but they might have stage 1 or stage 2 hypertension and not know it. There's a lot of need out there that I think people don't perceive because they feel because they're asymptomatic. But just because you're asymptomatic doesn't mean you don't need to be engaging with a healthcare provider. And that's a fallacy. Wait till there's symptoms. So I do think as we get more and more mature, people will start to realize that the experience that maybe everybody is familiar with, the retail pharmacy experience, whether or not you have a primary care provider or not, you probably had transited a retail pharmacy at some point in your life. And it's probably been less than thrilling. And so people are indexed to not want to actively seek out healthcare services proactively because why would you seek out something that is difficult if you don't feel like you have a need? I think through acquisition, which we've done, and strategic partnerships, which we have done, I think it's just not as talked about. We as an industry will move forward, but there's a lot of desire and willingness to collaborate on our end because we realize we can't do it alone.
Yeah. I know it. That was my last question, but now through this conversation, make me think about another question. Being where you are, and you have a lot of colleagues who are working in not Amazon healthcare, seeing how Amazon impacted the consumer market, do people feel like the threat? And like, what have they said to you? What make them feel like, oh, this is something that they don't like or something that they're worried about?
I'll be honest, I haven't gotten a lot of anxiety, which I think is telling because I do think, I'll be blunt, I think the lazy take from many, and we've seen it in the last 5-10 years, the lazy take is, oh, Amazon's coming for our lunch in X industry, whatever that industry is. And in healthcare, I think it's a lazy take to say that, here we are looking to incur on somebody's market cap. Not at all. I think that the savvy take and the folks that have actually experienced it, whether they're clinicians or patients, when they truly experience it and see it for themselves, it is obvious to them very quickly that what we've built is not simply recreating somebody else's model. And because we know that model, one, doesn't work. So at the end of the day, the only reason, speaking strictly, say, for pharmacy, that we're in it is we think we can do it better. And I think in 4 years, we've already shown that we can do mail order pharmacy better than anyone else. And I am a firm believer that as more and more people actually experience and see it, it'll become immediately obvious, like, gosh, yeah, they can do something that no one else can as well. And they're in this because it makes a ton of sense for them to be in this. And it's going to help. It's actually at a lower cost going to improve everybody's health because they're more willing to navigate it and proactively engage in it. I used to think that this is just our hypothesis, Christine. Like, oh yeah, this is what's motivating us. But now I'm seeing that we're actually we're demonstrating proof points, whether it's in the peer-reviewed literature. Amazon Pharmacy just actually was able to. We've applied large language models to bolster our patient safety efforts. How we ingest prescription medications into our digital environment. Our science team wrote that up, our approach, and it got published in Nature Medicine in March of this year. You can look it up. Um, uh, some of our work has been submitted to some of the leading healthcare journals in the country, like JAMA, that highlight how our efforts at convenience and affordability are actually driving improvements in downstream adherence. There's something here that's happening that is unique, and I think it's sort of that magic unlock that people have been waiting for when it comes to big tech and healthcare, which is how do you leverage the very best of your core strengths to really get the consumer experience or the patient experience right. Again, we're so early in our journey, but I think it's finally time to say that we're also figuring it out. And I think, and others are publishing just like we're publishing on our direct impact. And so this is real. And so for those that want to say, they're anxious about us or whatever it may be, good. I'm glad that there's some healthy anxiety out there. I think Mark Cuban and some of the other startups that are creating different conversations about what people and patients should be expecting out of their pharmacy experience. That's a good thing, because for far too long, I think the incumbents have been too comfortable, and it's good that we're pushing on and creating some, I think, healthy anxiety on what the future could hold.
Yeah, no, I agree. It's just make me, I think, as a consumer, as a future patient and current patient, I think it's good. And we all be
I
talking
agree.
about healthcare is broken, healthcare is broken. So I think it's good to see that some, path to everybody's trying to make a difference and to make it better. So
Agreed.
thank you for your time. I really appreciate your insight and sharing it with all of us today. And
Thank you.
can't wait to see the progress that Amazon is making and what are the things that you're working on next too.
Likewise. Christine, as always, I love seeing you. Prefer it was in person, but we'll take the opportunity to always connect digitally, and I can't wait to see you before long.
Sounds good. Thank you.
Thank you.
Thank you for tuning into today's episode of the Health Technology Podcast. We hope you found the conversation insightful and inspiring. If you enjoyed this episode, please take a moment to subscribe, rate, and leave a review on your favorite podcast platform. Your feedback helps us continue bringing you the latest in health innovation. Stay connected with us on LinkedIn and Twitter for updates on upcoming episodes and more. Until next time, keep pushing the boundaries of what's possible in healthcare. I'm Christine Minato, and thank you for listening.